presentation was organized by Samina Khaled as part of requirements of HAP725 course in Healthcare Informatics at George Mason University. This analysis is based on data available at CMS Hospital Compare website. It included all the data available as of December 15, 2019. This analysis is limited in several ways. The data were not available for all years. It is possible that as more data become available, the conclusions reached could change. The data in this analysis are not case mix adjusted and may not reflect changes in patient mix at different hospitals. It is possible that Inova Fairfax Hospital has received sicker patients in years where outcomes fall outside of control limits. This study focused on a convenient set of measures of quality. It is possible that if other measures are selected, the results and conclusions we have arrived could be different. Additional, more comprehensive set of measures are available but were not used. We chose the control limits using a 95% confidence interval. This means that in 100 observations, we expect that 5% of the data will randomly fall outside the control limit. The competitors of Inova Fairfax Hospital included in this study are Western Hospital Center, Virginia Hospital Center, Sentara, Northern Virginia Medical Center, Sibley Memorial Hospital, and MedStar Washington Hospital Center. To receive payments from CMS, hospitals are required to report data about some infections to CDC's National Healthcare Safety Network. The HAI measures show how often patients in hospital contract certain infections during the course of their medical treatment when compared to other like hospitals. X-axis in this chart shows the dates in which data on central line-associated blood infections were available. On y-axis, we show the overall hospital score within a year. The red lines show control limits. These control limits were derived from variation of ratings across other area hospitals that compete with Inova Fairfax. Inova Fairfax Hospital and its competitors do not differ in central line-associated blood infections. The 30-day death measures are estimates of deaths within 30 days of a hospital admission from any cause related to stroke. On the y-axis, this chart shows the dates in which data on 30-day mortality rate for stroke patients were available. Y-axis shows the overall hospital mortality rate within a year. The red lines show the control limits. These limits were derived from variations of ratings across other area hospitals that compete with Inova Fairfax. Inova Fairfax Hospital and its competitors do not differ in 30-day mortality rate for stroke patients. However, the 30-day mortality rate for stroke patients have decreased over the years for Inova Fairfax Hospital patients. 30-day unplanned readmission measures are estimates of unplanned readmissions to any acute care hospitals within 30 days of discharge from hospitalization for any cause related to medical conditions, including heart attack, heart failure, pneumonia, COPD, stroke, and surgical procedures. X-axis on this chart shows the dates in which data on 30-day overall readmission rate were available. Y-axis shows the 30-day overall readmission rate within 12-month period. The red lines show control limits. These limits were derived from variations of ratings across other area hospitals that compete with Inova Fairfax. Inova Fairfax Hospital and its competitors do not differ in 30-day overall readmission rate. The overall score for serious complications is based on how often adult patients had certain serious but potentially preventable complications related to medical or surgical inpatient hospital care. Reporting cycle for this measure is 24 and data is refreshed annually. On x-axis in this chart, shows dates in which data on postoperative respiratory failure rate was available. Y-axis shows the rate of postoperative respiratory failure. Red lines show control limits. These limits were derived from variations of rating across other area hospitals that compete with Inova Fairfax. Over time, Inova Fairfax Hospital reduced the rate of postoperative respiratory failure compared to other hospitals. Medicare spending per beneficiary measure assesses Medicare Part A and Part B payments for services provided to Medicare beneficiaries during a spending per beneficiary episode that spans from 3 days prior to an inpatient hospital admission through 30 days after discharge. X-axis in this chart shows dates in which data on Medicare spending per beneficiary were available. Y-axis shows the score of Medicare spending per beneficiary. The red lines show control limits. These limits were derived from variations of ratings across other area hospitals that compete with Inova Fairfax. For year 2015, Inova Fairfax have received more payments than other area hospitals. In other years, Inova Fairfax Hospital and its competitors do not differ in Medicare spending per beneficiary. In summary, Inova Fairfax has reduced rate of postoperative respiratory failure than its competitors over the year. Finally, Inova Fairfax was same as its competitors in central line associated blood infections, 30-day mortality rate for stroke patients, 30-day readmission rate, and Medicare spending per beneficiary.